Hello, my name is Fiona Davies from PoCoG. We recently published a systematic review of health professionals' views of online psychological therapy. While there's been quite a lot of research published on participants' views of online treatment, there's a lot less information available on the views of referrers, who are often the gatekeepers to treatment. We were interested in this topic from a health professional perspective. Here are the details of the review, which was published in the Journal of Medical Internet Research. The review team included myself, Dr. Heather Shepherd, Dr. Lisa Beatty, Brodie Clark, Professor Phyllis Butow, and Dr. Joanne Shaw. Why did we do this review? Well, the starting point for us was the experience of the research team who had been involved in design and implementation of online programs that experienced lower than expected uptake after successful trials. In particular, we were interested in how we could increase uptake by increasing referrals from health professionals. Additionally, there's been increased interest in and development of online psychological treatments in many countries, but relatively little research on uptake and implementation in routine care. We use standard methodologies to complete this review. Further details are in the paper, but I won't go into too much detail here. We registered the trial with Prospero, searched the main databases, and included a wide variety of search terms. We decided to include all study types to maximise the data available. We analysed the quantitative, qualitative and mixed methods studies separately and completed risk of bias assessments. We then looked at common findings across the study types. Now let's look at the results. First off, as you can see, there's relatively little research in this area. We used a wide variety of search terms to capture as many studies as we could. Our initial search captured 4,210 papers, which was narrowed to 67 papers after the removal of duplicates and the title and abstract search. A further 42 articles were excluded after the full text papers were reviewed. Of these, there were some studies which did include health professionals, but the data was merged with those of participants and we excluded them on that basis. We identified 6 broad themes in the data, as you can see in the diagram. These mapped well to the domains of the Consolidated Framework for Implementation Research, or CIFR. I'll run through these one by one, starting on the left. So client factors included information about who might be suitable for web-based therapy based on criteria like access to the internet, diagnosis, severity of symptoms, age, motivation, concerns about stigma, and so on. Health professionals were largely unfamiliar with web-based approaches. The main barriers, aside from this lack of familiarity, were concerns about workload and lack of training. Those who were familiar with web-based approaches described them as both less engaging and less taxing than face-to-face therapy. Therapeutic relationship concerns were raised in 10 studies, with those who were experienced in providing online therapy much more positive about the potential for developing therapeutic relationships online. Therapy factors related to the specific content or therapeutic approach, such as CBT and skills practice, and the balance between structure and tailoring. Organisational and systems factors included training, work organisation, privacy and security, management support, and being able to see the content of online therapies and integrate them with face-to-face care. Models of care related to how online treatment might be integrated into routine care, with health professionals being more comfortable with therapies that were blended with face-to-face care or included some level of therapist guidance. It's telling that most health professionals were unfamiliar with online treatment, around 98% in the studies that directly assess this variable. This suggests that we have a long way to go in educating and familiarising health professionals with online therapies if we want them to be active referrers to these types of programs. Our findings suggest that health professionals are more likely to be comfortable with online treatments which take the following factors into account: allowing some tailoring of content, targeting patients with mild to moderate depression and anxiety, low risk factors, and good motivation and access to technology, blending online with face-to-face care, selecting content health professionals see as most acceptable, such as skills practice. As mentioned previously, training health professionals in programs and how to use them. And finally, having good systems to support health professionals in the use of online programs. We believe it is important to consider the model of care when implementing online treatments and are currently completing some further research to better understand what this might look like in cancer care in an Australian context. Thank you for listening to this presentation. We hope it's been useful for you. I encourage you to read the full paper if you're interested in further information on this topic.